Pro Group Management, workers' comp that works for you.
Welcome to Nevada Newsmakers. On the broadcast today, Caleb Cage joins us. He's Incident Commander for the Nevada COVID-19 Response Team. He's with the Nevada National Guard. He's here for the whole show on an all-new Nevada Newsmakers.
Hello, is this D&D Roofing?
Yes, it is. How may I help you?
You did such a great job on my roof. May I speak to the owner?
I am an owner.
Oh, can I speak to your supervisor?
Sure.
How may I help you?
I love your work. May I speak to the owner?
I am an owner. We're all owners. Well, that's why at D&D we work so hard to keep your home safe and sound.
Oh, no wonder.
D&D Roofing and Sheet Metal. Local, employee-owned, here for you.
Retail's impact on Nevada's economy? Enormous. 8,600 businesses, large and small, employing 145,000 workers. And last fiscal year, retail paid tax on nearly $60 billion in sales. We're the Retail Association of Nevada. We support retail, we help it grow, and we mean business.
RANNV.org.
Take a look at Pro Group Management and see how your workers' comp requirements can be met head-on. By taking a proactive approach, Pro Group can assure that your company is meeting or exceeding state and federal standards. As you move forward in your industry, Pro Group moves with you, simplifying regulatory tasks, clearing the way so you can get the job done and look to your future success. Pro Group Management, workers' comp that works for you.
Early in the morning or throughout the night, professional truck drivers are on the job, serving you, safely moving freight that's crucial to our economy. From the oldest industries to our newest innovators, from the exotic to the everyday, trucks are everywhere, moving everything. Never afraid to embrace a future that makes Nevada and our nation stronger. Trucking moves America forward.
This is Nevada Newsmakers with host Sam Shad, a no-holds-barred political forum. Now, from the Nevada Newsmakers broadcast headquarters, here is Sam Shad.
And back on Nevada Newsmakers, we're always pleased to welcome back to the program Caleb Cage. He's the Incident Commander for the Nevada COVID-19 response with the Nevada National Guard. And we know you, of course, as an Iraqi veteran and an author. You're also on loan to the Guard from NSHE, where you do workforce development. So let's start out with what's the mission for the Guard?
So the mission for the Guard right now is conducting all of the response operations for and coordinating all the response operations throughout the state for the COVID-19 response for the state of Nevada.
Okay, and so in real terms, what does that mean?
That means everything from really providing structure to the overall process, so coordinating between all of the state agencies, coordinating with us to make sure that we, being the Division of Emergency Management, have everything we need to make sure the resources are being provided and coordinated in a way for Nevada's tribal governments and county governments and city governments, but also making sure the communication, external communication, making sure we're communicating with the public about what's going on. And then falling under all of this is also the long-term recovery effort, which is on everybody's mind in a pandemic like this. What does this look like when it's all over, and how do we get back to normal, and what does normal look like?
Okay, so is the Guard in support of state and local government rather than being the lead, is that correct?
Yeah, so in all emergencies and disasters, the local government, the lowest level, the most local level of government is always in charge until they request support from the next higher up, and that is cities and counties, and usually we work with county and tribal governments at the state level to support their efforts. So the local government may have a specific need, a specific resource request. We would identify what the best resource request way to fill that resource request is, and sometimes that's going to be National Guard support. We're seeing more and more usage of the National Guard soldiers out there, and airmen and women. So yeah, it's very much a support role for local government in this case.
What's the biggest need been so far?
Without a doubt, the biggest need has been personal protective equipment, or PPE, as it's commonly called, and that has been a global need. We've run up against a supply chain issues from around the world, and everybody competing for the same resources. So that's been a challenge. We've been, I think, pretty creative in how we've been addressing that challenge, but it's going to continue to be a challenge as well.
If you can share, where are you obtaining the equipment from?
So a lot of this is N95 masks and surgical masks and those sorts of things. So first and foremost, we're asking entities, organizations that need it to use their normal supply channels, because they need to be able to provide it for themselves if they can, and we're in support of that. And so we have the state of Nevada, through the Division of Emergency Management, has been purchasing through normal purchasing channels as well. Some of that we've been advertising opportunities for larger bulk donations from a doctor's office that may not be needing it right now because they're closed down, and how can they provide that equipment over in larger numbers. We're asking if people have smaller amounts in their home that they share that with their neighbors and share that with their family and use it locally. And then also the really large bulk is coming from what we're seeing is that what we're calling the private sector task force. So this task force that's been set up to use global supply chains in order to bring.
This is Jim Murin's group?
Okay. Yep. And so they're making these major donations to the state and really providing some key logistical support as well.
Are we seeing private enterprise jumping into this, fully fledged to be able to assist here? Because we saw this massive donation from Las Vegas Sands, but I know other companies are doing the same thing.
There is a lot of, and I think the bigger question is, just in my life, I probably get 3 or 4 texts or emails a day of people saying, "Hey, I'm an attorney. We're all working from home," or whatever their profession is, and asking how they can help. And that's just me. I know that there's a huge desire from the public to help. I would say the corporate assistance has been enormous, and everybody's looking for ways to get through this together and get through this as quickly as possible, so that we can get back to the Nevada we remember from January.
And yes, of course, everybody's hope is that, and the sooner the better, but with caveats. One of the concerns from the public initially was that bringing in the Guard was, essentially declaring martial law. That's not the case at all, correct?
That's absolutely not the case. Yes.
Go ahead.
That the Guard has been brought in because they have very well-trained skills in managing incidents of this size, and they have a role in civil supporting the civilian government in emergency and disasters. We've used National Guard support. When I was the chief of emergency management, we relied on National Guard support for probably 90% of the incidents that we went through. Worked very closely with them.
Have there been practice runs for something like this? I know in New York City that they had been training for a pandemic, but they said that it doesn't matter how much you train, you never really are going to deal with the difference between dummies and real people.
I agree with both of those statements. Planning, training, exercise, what we refer to as basic preparedness, is absolutely critical. But your plan is never going to survive first contact. It's never going to survive the application as well as you would expect.
So it's literally a war, because that's exactly the same plan that applies to going into battle, which is, whatever plan you had goes away the first day that you encounter the enemy.
Yeah, exactly. It's the planning, the mechanisms that are in place for planning are intended to identify what are the weaknesses, what relationships need to be built, how we can work together towards this and get everybody on the same picture. And when the incident happens, in this case a pandemic, we have to respond according to the conditions that sets. They aren't notional anymore. So that is something that you said, New York has done 2 things here. The first is that they've been preparing for this. I remember when I So 5 years ago, when I took over as chief of emergency management, before I went to my current job and came back, the very first exercise we supported was a public health exercise on pandemic and what we're doing to respond to that. And it became a regular part of our planning, training, and exercise cycle. But just as in New York's case, your notional plans in the comfort of a room where there are no consequences aside from ways to improve versus now where the consequences are high, are very dramatically different situations.
At this point, how many meetings per day are there to update on the situation, and what are they based on? Do you start out by talking about the situation in Las Vegas, then Reno, and going through population centers? Is it urban versus rural? And I don't mean versus, but urban and rural. How are the meetings logistically applied?
Yeah, so with the state level within the Division of Emergency Management, and I know that there are meetings happening around the state between different entities and agencies, and I would say my life is a life of meetings. I go from one meeting to the next and maybe have 30 minutes to get caught up on things or compile things, whatever I need, and then usually get caught up on everything in the evening. And that's really a function of emergencies, because communications is so important during these events, making sure we know where everybody's moving. We start our day with an operations briefing. We go right into a general staff meeting, command and general staff meeting, and then we have a jurisdictional meeting at 10 o'clock every day. So Nevada's tribes, counties, and cities who wish to participate all join for a call, and we get an update from everybody. We identify needs and ways that we can help going forward. We highlight specific things that we want to focus on, and then that just continues throughout the day. I know that there is I participate in a daily meeting with the governor and provide him information, get his input and feedback, and then we continue on through there. So it really is a rhythm of meetings throughout the day, with a lot of work to support that and to support the operations as well.
You've mentioned several times during this conversation tribes.
Mm-hmm.
What are the greatest needs for tribes, and how badly are they being affected by this at this point?
So tribes are unique in a lot of ways, and most important is their sovereign nation status, which is extremely important to observe and respect. And that's something that we've worked. I know that in my experience we've worked very hard to address going forward. As sovereign nations, they can. They're making their own decisions on what the public health and public safety needs of their community are. So their needs are the same needs as everywhere else. They tend to be in more remote and rural areas. The urban tribes in Las Vegas and Reno and otherwise are faring just like pretty similar to how everybody else is faring. Out in the more rural areas where they're further away from grocery stores, right? They can't make that trip to go and get those resources that we may take for granted, but also personal protective equipment and testing equipment and those sorts of things that we've been working to assist them with as well.
Are we seeing a higher incidence of COVID-19 in Hispanic and African American communities as well as tribal communities?
You know, that's a very good question, and I've read those numbers and I've seen those numbers around the country, and I've seen the impact that it's had on different demographic populations. Right now, our focus as really supporting the jurisdictions in meeting all of their needs, and making sure there's hospital capacity for in the event of a surge in patients.
And just to interrupt you for a second, we talked to Mason Van Hel from UMC last week, and he was saying that there really is capacity at the hospitals, that all the hospitals in Las Vegas, and we're seeing the same thing in Northern Nevada, that some of the extended facilities, like talking about the convention centers, at this point it's a discussion, it's not a need. Are you comfortable at this point that unless there is another surge, that we are good where we are at this point?
Well,
in terms of capacity.
In terms of capacity, and that is the hardest question, and one that I do not envy our local partners in having to answer. And I'm not trying to dump it on them, but it is their question to answer. And we are all working off of models, and models are predictive, and best case, oftentimes they give us an example of how things may go, and it can change any day, right? And so we've worked very closely with Clark County and Washoe County in particular to make sure that they can surge their capacity. And we've seen private entities, the hospital here in Reno, Renown, has built out its parking garage into a facility. So there is capacity for the needs right now. We just need to be able to make sure that if they need to flip a switch and expand their capacity very quickly, that we're able to support them. Am I comfortable? As comfortable as the models allow me to predict and be? Yes. Mostly I'm comfortable that we're in very good and regular communication with our local partners to make sure when they do need that need, we can meet that need.
And I think it's the function of emergency planning, that you plan for the worst and hope for the best.
Absolutely. Think catastrophically is how it's always been taught to me. Think about the worst case scenario and spool it back from there. The worst case scenario is very expensive and takes time and costs to address. And so the folks who are having to make these hard decisions are making them very carefully with the needs of their communities and their taxpayers in mind.
All right, let's take a break more with Caleb Cage when we come back.
Hey, Dad? What are you learning? This place is great. Huh? You gotta try this.
Wow, this stuff is great. People are gonna love it.
Yes. Yes, they will.
Ahern Rentals began as Signal Gas Station on Las Vegas Boulevard. Founder John Ahern grew the business by offering rentals. His son Don built on John's legacy, growing Ahern Rentals into the largest independently owned American rental company, with 89 locations in 30 states. Don also brought his experience and vision to equipment manufacturing with Extreme Manufacturing and Snorkel. Today, Ahern Rentals continues to bring its family values to a new generation. Learn more at ahern.com.
Hi, I'm Eric Robnett, owner of Home Energy Experts. Has this ever happened to you?
Honey, did you remember to turn down the thermostat?
Forgetting to set the temperature? Not fun. We can help. Our new smart thermostat keeps the temperature set for your comfort all by itself.
I'm feeling hot now.
To increase your comfort, go to homeenergyexperts.com for details. That's homeenergyexperts.com.
The signs and symptoms of cataracts can start out small with subtle changes in your vision. So don't wait. Be proactive and take your vision into your own hands. If you're experiencing the onset of cataracts or just have questions, contact your eye care professional or call Eye Care Associates of Nevada today. Dr. Hiss has years of experience specializing in the surgical correction of eye disorders and has completed over 84,000 vision correcting procedures. At Eye Care Associates of Nevada, we'll change the way you look at the world.
This is Nevada Newsmakers.
And back on Nevada Newsmakers, we continue our conversation with Caleb Cage. He's the incident commander for the Nevada COVID-19 response. He's with the Nevada National Guard. We got a message from Marilyn Kirkpatrick, the chairwoman of the Clark County Commission, and John Lee, the mayor of North Las Vegas, talking about plans for reopening the state. But really, in the last 24 hours as we are taping this, I think there was probably an even more significant statement which came from Matt Maddox, the CEO of Wynn Resorts. And he describing what Wynn Resorts is going to do, but it seemed to me that he pretty much stepped into the leadership position as far as the gaming industry goes. Am I correct in assuming that?
So I think that Mr. Maddox's op-ed was extremely thoughtful and put out there a message that said this is what we are doing as an industry in order to move forward. I think that what all business owners in the state and around the country and maybe around the world right now are trying to determine what and when reopening is going to look like. They have employees, they have shareholders, they have debt,
supply chains,
and all kinds of things that have been put on hold. And I've heard Governor Sisolak say a number of times, no one wants the economy open quicker and more than I do. And I think that I think that's accurate, and I hear that in the discussions we have with him on a daily basis. But with the caveat that it has to be done in a way where we can prevent what's happened in places around the world where countries have reopened in certain ways and then had to close back down again. We've seen that in Japan and other places where they've had a second spread of the virus, and we cannot put ourselves at risk that way. So is he taking a leadership position? I would say certainly he's speaking for Wynn and Wynn Resorts and the broader community that he's a part of. But he's laying out a logical plan that says these are the things we need to do going forward.
Okay, so one of the things that he suggests is taking the temperature of everybody that comes in the building, whether it's employees or customers. So as a logistics person, do we have the supply of temperature gauges of one kind or another to be able to do this? Because if we're going to do this at Wynn Resorts, we're going to do it at every property on the Strip, every business, period. I mean, a lot of companies like Walmart and others are already taking the temperatures of their employees. Do we look at this from a logistics point of view and say, yeah, we're in good shape here, or is there going to have to be a massive ramp up?
No, and one of the it's a great question, and I think it's embedded in the larger question of what does the new normal look like on the other side of this? Are we wearing masks in restaurants and grocery stores and those sorts of things?
And the answer apparently is yes.
Apparently is yes, for at least some time, and we certainly are right now. And for how long will that continue? The framework that will reopen the state that I've heard the governor talk about is one that is based on scientific data driven by medical experts and technical experts in this field that says these are the conditions.
Okay,
that
but
we
I mean,
must
just
meet
because we're short on time now because we did such a long first segment. So my question is, logistically, do we have the ability for businesses across the state to be able to take the temperatures of people as they come in through their business?
So businesses, first and foremost, are responsible for whatever measures they put in place in order to reopen and those conditions that they have to meet. So I can't speak for individual businesses. I would say if that becomes a requirement that we need to meet, we could certainly spool up those resources and provide those whatever resources we need to counties.
So you believe that those are available in the quantity that we would need?
I think that we are having massive supply chain challenges around the world, and that when we get to reopening, we'll have the same supply chain challenges that we're having with PPE right now. So do I believe that they're available right now? No. Do I believe that we can that the market will respond and provide those resources? Yes.
And we'll be right back.
Dimitri Prine here for Design Outdoor. At Design Outdoor, we specialize in all hardscapes, pavers, and walls you'll need for everything, from wonderful small yards to full-blown outdoor living. And we only refer the best contractors to make your vision a reality. Our store and backyard are located at 11600 South Virginia, just north of DeMonte Ranch Parkway. Visit designoutdoor.com or call us at 851-9499.
I'm men's rights attorney Marilyn York, and because I represent men in all family law matters, women often call me gender traitor, woman hater, and even disgusting. So why represent men and target myself with these offensive monikers? It's simple. Children with fathers in their lives are 6 times less likely to drop out of school, 15 times less likely to go to prison, and 5 times less likely to commit suicide. So ladies, you can hate me, but please love your children more than you hate their fathers.
Hi, I'm Dave Newman. Remember me? I used to be the house detective, and now I'm a realtor full-time at RE/MAX Realty Affiliates. And a lot of people ask me, how's the market? You know what? It's fantastic. If you're even kicking around the idea of buying or selling, give me a call. Let's talk about it. Call me at RE/MAX Realty Affiliates and just ask for the guy who used to be the house detective, Dave Newman.
The signs and symptoms of cataracts can start out small with subtle changes in your vision. So don't wait. Be proactive and take your vision into your own hands. If you're experiencing the onset of cataracts or just have questions, contact your eye care professional or call Eye Care Associates of Nevada today. Dr. Hiss has years of experience specializing in the surgical correction of eye disorders and has completed over 84,000 vision correcting procedures. At Eye Care Associates of Nevada, we'll change the way you look at the world.
This is Nevada Newsmakers.
I'm back on Nevada Newsmakers. Our final minutes here with Caleb Cage, the incident commander for the Nevada COVID-19 response. He's with the Nevada National Guard. Looking at the video from New York City of the mortuaries and the cold storage trucks that are sitting outside those, I mean, it's just stunning. That's supposed to hold 45 bodies are being refitted to hold 3 times as many. We have been incredibly lucky in Nevada by comparison, and not to take away from anybody that's passed.
Absolutely. Not a day goes by that we aren't reminded of how grim of a reality we're facing in this incident, and that's a conversation I have all of the time. This is everyone I know, and it seems that our entire social networks are made up of people who've been affected directly or who've died or have contracted this disease for themselves. This is an incredible impact on our community and our nation, and we're seeing that in New York right now as sort of the epicenter of this.
And that's where we have to leave it. Thank you for your service as always.
Thank you, Sam.
And it's a pleasure to have you back on the program, but not under these circumstances.
Yes, sir.
And we'll be right back.
As you know, Reno is booming. Toll's development company is helping it grow with insightful design and development, building community with every project, adding beauty, adding excitement, emphasizing our shared humanity. Reno is becoming bigger. Toll's development is helping it become better, more livable, more enjoyable. To learn more, go to tollsdevelopment.com. tollsdevelopment.com.
Take a look at Pro Group Management and see how your workers' comp requirements can be met head-on. By taking a proactive approach, Pro Group can assure that your company is meeting or exceeding state and federal standards. As you move forward in your industry, Pro Group moves with you, simplifying regulatory tasks, clearing the way so you can get the job done and look to your future success. Pro Group Management, workers' comp that works for you.
You can now watch Nevada Newsmakers on YouTube. Just go to YouTube and search for Nevada Newsmakers and become a subscriber. We'll see you on the next broadcast. Thanks for watching and listening.